Another major difference with the CPT coding is that when you are going to code for the surgeon, you will have to report all the procedures that are being done under a given session. Say for example, the physician is going to do a major procedure, say for example a gastrectomy. At that time, there is also a hernia repair on the right side that is being done. And thirdly, the patient also has an abscess on his forearm which is being drained. Here in this particular scenario, we are going to report the codes firstly for the gastrectomy that is being done with the 4 series code, and then secondarily we are going to assign the code for the inguinal hernia repair code, and thirdly you are going to report a code from the dermatology or the integumentary section for the incision and drainage. So you will be reporting all of these codes in the order of decreasing phi value or units. But what happens when you are going to report for the anesthesiologist? So here the surgeon is performing all these procedures, but the duty of the anesthesiologist is to make the patient unconscious, right? So that the patient does not feel his senses. He should be unconscious. So credit is only being given for the time and for the duration with which the patient is unconscious. So it does not matter to the anesthesiologist what are all the procedures that are being done. So the only concern is the time factor plus what is a major surgery that is being done. So here we know gastrectomy, hernia repair and incision and drainage of an abscess. So gastrectomy is a major procedure. So you will have to report the ASA code for gastrectomy. So just go to the anesthesia section and there you would find as all the anatomic classifications are being listed from head, neck, thorax, upper limb, lower limb and all that. So you can very well pick the code from the anesthesia chapter. So that's basically the difference between the surgical coding and from the anesthesia coding. Because surgical coding is difficult, you need to categorize or you need to assign the codes for all the services that the surgeon does. Whereas for the anesthesiologist, you are supposed to report the only one code for the major service that has been done. You need not bother about the other services, provided you should know the base value or the base unit of all these procedural codes, because these are given under the ASA manual itself. So every code will have its base unit. From that you can figure out, because you should always report the procedural or the ASA code with the highest base unit.